The city faces a crisis of epidemic proportions. The rate of HIV/AIDS cases has skyrocketed by 22% since 2006. According to a recent report, 1 in 20 DC residents are affected by AIDS. The capital now rivals with some parts of Kenya and Uganda for the highest rates of HIV/AIDS in the world. So urgent is the concern that the HIV/AIDS administration took the relatively rare step of couching the city's infections in a percentage. The district's report found a 22% increase in HIV and AIDS cases from 12,428 reported at the end of 2006 to 15,120 cases in 2008, touching every race and sex across the population and neighborhoods, with an epidemic level in all but one of 8 wards.
The truth is that DC has an epidemic that's different than the rest of the country. In DC, a general epidemic in public health terms is 1%. DC has a 3% epidemic, and maybe even a 5% epidemic. That means that there really are none of us are really safe or protected from HIV. There really are no groups that don't have HIV in them. So it's really important that we think about how to get the messages out so that we all understand that we're vulnerable to HIV, and we take decisions, personal decisions, to be responsible for our own bodies, who we have sex with, who we share needles with, to make sure that we can protect ourselves from HIV.
There is good news in the AIDS office report. More people are getting HIV/AIDS diagnosis early while they are still healthy as a result of a policy of routine testing implemented by the city in mid-2006. Publicly supported HIV testing expanded by 70%. However, in the end, the most effective method of controlling the spread of HIV/AIDS is just plain choice. It's your choice.